information about Naegleria fowleri, including detailed explanations for the correct and incorrect choices. The final question addresses treatment. Question 1. Clinical presentation. A previously healthy 12-year-old boy is brought to the ER with fever, severe headache, vomiting, and altered mental status. His symptoms started 2 days after a family trip to a freshwater lake in Florida. On physical exam, he is febrile, disoriented, and has signs of meningeal irritation. What is the most likely diagnosis? A. Bacterial meningitis. B. Herpes simplex encephalitis. C. Primary amoebic meningoencephalitis. D. Viral meningitis. E. Toxoplasma encephalitis. C. Primary amoebic meningoencephalitis. Explanation. This is classic for Naegleria fowleri infection. Freshwater exposure plus rapid onset meningoencephalitis equals key clue. The amoeba enters via the cribriform plate, CNS, rapidly fatal. Why not the others? A. Bacterial meningitis, possible but less likely with lake exposure, and this rapid course. B. HSV encephalitis, often affects temporal lobes, no lake exposure link. D. Viral meningitis, less severe and slower onset. E. Toxoplasma affects immunocompromised, causes ring-enhancing lesions, not this acute picture. Question 2. Diagnosis. Which of the following findings is most likely to confirm the diagnosis of Naegleria fowleri infection? A. Gram stain of CSF. B. India ink stain of CSF. C. Wet mount showing motile trophozoites in CSF. D. Latex agglutination test. E. AFB stain of CSF. Correct answer C. Wet mount showing motile trophozoites in CSF. Explanation. Naegleria fowleri can be seen as motile amoebas in fresh CSF wet mounts. Confirmatory lab finding for primary amoebic meningoencephalitis. Why not the others? A. Gram stain, bacteria not protozoa. B. India ink, used for Cryptococcus. D. Latex agglutination, also for Cryptococcus capsular antigen. E. AFB stain for tuberculosis, not amoebas. Question 3. Treatment. A 14-year-old boy is diagnosed with primary amoebic meningoencephalitis after swimming in a warm lake. He is in critical condition in the ICU. Which of the following treatments has shown effectiveness in the few reported survivors? A. Acyclovir. B. Ceftriaxone. C. Amphotericin B. D. Metronidazole. E. TMP-SMX. C. Amphotericin B. Explanation. Amphotericin B is the main agent used in Naegleria fowleri cases. Though most infections are fatal, a few survivors were treated aggressively with IV and intrathecal amphotericin B. Why not the others? A. Acyclovir, HSV encephalitis. B. Ceftriaxone, bacterial meningitis. D. Metronidazole, effective for Entamoeba histolytica, not Naegleria. E. TMP-SMX, pneumocystis and toxoplasma prophylaxis treatment. Let me know if you'd like integrated